Okay, so the adrenal glands are the two glands which are placed in on top of the kidneys on either side, and it has got two parts. Each adrenal gland. One is the outer part called adrenal cortex, and the inner part which is called adrenal medulla. Now, in general, adrenal gland is the gland which deals with the stress. So the central parts release the hormones which are like adrenaline kind of hormone, which allows your body to fight with the situation. On the other hand, the cortex is the one which secretes other hormones such as cortisols, such as aldosterone, and the androgens as well. So, the role of the adrenal gland is very vital in the body. It can be affected if there is some damage to the adrenal gland because of any region, which could be tumor, infection, autoimmune process, uh, and then the presentation could be quite different depending on what exactly is the wrong problem with the adrenal gland. Most of the time when we are talking about adrenal gland disorders, we can have issues which are related to the excessive hormone secretion. So if there is too much hormone coming from the adrenal gland, such as adrenaline, then it's because of a condition called pheochromocytoma. On the other hand, it can make a lot of cortisol hormone, and that's because of the adrenal making a lot of cortisol, and condition is called Cushing syndrome. It can make too much of the aldosterone, resulting into Cone syndrome. So it's too much hormone can be a problem. On the other hand, many of the time we are worried about when adrenal gland is not making enough hormone, and that's called adrenal insufficiency, which we see more commonly, and it could be a more serious situation. So I think we should spend some time talking about the adrenal insufficiency today, which is a very important condition to deal with. Yeah, so if we focus on the adrenal gland insufficiency, when adrenal gland is not making enough cortisol hormone, that is adrenal gland insufficiency. And it could be because of the primary problem with the adrenal gland itself. There could be damage to the adrenal gland because of the infection, because of the calcification, because of the hemorrhage or bleeding within the adrenal gland. And many a times is because of the autoantibodies which are destructive to the adrenal gland itself. And when that happens, the adrenal gland does not make enough cortisol hormone. On the other hand, it could be because of another hormone coming from the pituitary gland controlling the adrenal gland, which is called ACTH, or adrenocorticotropic hormone. So if there's not enough ACTH coming from the pituitary gland, then again the adrenal gland can become a bit lazy, and then that's again another cause of the adrenal insufficiency. Many a times, adrenal insufficiency also happen when people have been on the some steroid hormone for another condition for a long time. So people take steroid hormone like prednisolone for their eczema or COPD or skin condition or some other kidney condition. If they have been on steroid for a long time, then the adrenal gland itself become dependent on the exogenous steroid, and itself does not make enough steroid when the need arises, and that could be a very serious condition. So when there is not enough cortisol hormone, it depends on the severity of the situation. So when it is mild to moderate condition, then in a chronic situation, patient will feel very tired, exhausted. They will feel fatigued. They don't have enough energy to carry out day-to-day work. They they might lose weight, they might lose appetite as well. So there's a general deterioration in the physical as well as the performance wise. The other issue which we need to be careful around adrenal insufficiency is that the patient will have low blood pressure. They will feel dizzy at times. They they also might carry low blood sugars as well. So low blood sugar related symptoms might be there. The blood pressure I mentioned could be low there. So if not adequately replaced, then this cortisol deficiency or adrenal deficiency could be very serious and could be life-threatening at times. So it depends the degree of problem there. Once it is diagnosed, it has to be very promptly treated. Yeah, so the most of the diagnoses are based on the clinical presentation. So we are focusing our discussion around the adrenal insufficiency. So the history in the clinical examination is very important. Approaching the right people early in the stage is very important. So if you have got symptoms, you need to contact the health professional soon. The checking the random cortisol may or may not be very helpful. So because the cortisol levels are a bit higher in the morning hours, and as the day progresses, the level will go down and they are very low during the night time. So the timing of the investigation is very important. Most of the time, the morning samples are more useful. However, for the definitive diagnosis of the adrenal insufficiency, we want to carry out a test called short selectin test. Now, in this test, we inject a chemical called tetracycline, which tries to stimulate the adrenal gland, and we try to see the response of the cortisol jumping from baseline to another level in 30 minutes and 60 minutes. And that gives you more accurate results. One has to be careful about the impact of other medication patient might be on at that time, such as oral contraceptive pills or anti-epileptics, and sometimes they can interfere with the assay. So it has to be done by the appropriate specialist. So once it is diagnosed, or even when it is suspected while you are waiting for the diagnosis, the replacement with the hydrocortisone tablet is very essential. So there are different steroids which can be used, but most commonly used steroid replacement therapy is the hydrocortisone tablet, which we tend to replace in the divided doses. So because hydrocortisone tablet is not long acting one, it works only for 68 hours. So you have to give the tablet 2 to 3 times in a day, depending on what is the requirement there. So many people are okay on reasonable doses of the hydrocortisone. However, some people might have difficulty with the absorption and the clearance, and they might need alternative way of providing the hydrocortisone. One has to also remember the sick day rule, that if the patient is unwell because of any medical illness, then they need to double the dose of the hydrocortisone. If they are not able to take the hydrocortisone tablet in form of tablet, they need to find the alternative way to give the hydrocortisone, which will be injectable therapy, and they need to access the medical services without any delay. So hydrocortisone remains the cornerstone of the treatment. Some of the patient might still need to go or opt for additional support if their blood pressure or the salt balance in the body remains difficult to maintain, and that is fludrocortisone, which has got a mineralocorticoid properties, and that helps with the maintenance of the salt balance and then the blood pressure. That's another molecule to consider. But most important thing is to follow the sick day rule, that they cannot omit the dose of hydrocortisone if once they have been diagnosed with this condition.